Modern technology touches on people's lives and different industries in many different ways, and addiction treatment is no different. I'm here today with Ben Hari, who's an addiction therapist and the VR lead here at Eden House, and we're going to talk about how he's using VR in addiction treatment at this site. How are you doing, Ben?
I'm doing very well, thank you.
Great. So tell me about that VR headset you've got next to you. How does that actually aid in addiction recovery here?
So the best way to describe it is kind of like a flight simulator for addiction. So just like how pilots use dangerous, high-risk situations in different simulations to train for real-life scenarios, that's exactly what we do with our clients here at Eden House.
And what does like a VR therapy session, what would it actually look like in practice?
So we invite the clients in and into this spacious environment, and we describe exactly what they can expect in a session. So what are they going to see? What do they interact with? And I explain that I can stop the procedure any moment. There is a very small exclusion criteria for people who take certain medications or have a history of seizures not related to alcohol addiction, but there are multiple different scenarios, very lifelike scenarios that people are likely to face when they leave treatment. So things like supermarkets, house parties, and barbecuing in nice sunny weather.
And are you so when people are being taken through those scenarios, are you stood next to them guiding through it, or do you let them just get on with it? How does that work during the actual environment scenario being played out?
So I'm with them the whole time. I tell them that I'm going to try not to speak to them too much because I can actually interact with the clients live using text-to-speech AI prompts. So there might be patrons in a bar or guests at a house party, and they can actually speak to the client whilst they're using the VR. So that's how I can communicate with them whilst they're using the VR. I usually won't talk to them for any other reason unless they're about to bump into something or leave the play boundary or something like that.
Right, yeah. And you sort of mentioned a few of the environments that can be created, or so you mentioned like, yeah, even a barbecue or something like that. Does that cover, I can think of lots of scenarios for maybe alcohol and drugs. You mentioned a house party. Does it also count for gambling, like is there casinos, things like that?
So it's very interesting. And I've been speaking with my team about this in depth, all who have very vast experience working with gambling addiction. And we find that with a lot of people who are struggling with a gambling addiction, they're kind of put into a cohort with lots of people who are struggling with, that's mostly made up of people who are struggling with alcohol and drug addiction. And while that's very valuable and does have its benefits, we feel like there needs to be something that's specifically tailored for those struggling with gambling addiction. So that is why we have a scenario called Bar with Slot Machines. So if they're also struggling with alcohol addiction, it's kind of like a bonus, like 2 virtual birds, 1 virtual stone and thing. So it's like a full bar with guests in the bar who are drinking. And there's also a slot machine there as well, and it has lots of flashing lights, all the sound effects, fully interactive buttons, and I can control whether the machine pays out or doesn't pay out. And this is really practical because we can actually see how our clients react to when the machine is actually paying out and when it's not. So it actually goes beyond just what talking therapy can achieve alone by itself.
Wow. Yeah. So it's actually a lot more than just putting someone in a scenario. Like I said, are you also, like I said, what are you monitoring at different points? Is it like, do you monitor like heartbeats or things like that? What is it?
Yeah, so we actually have this cool little device. It's called a biofeedback sensor. And all it does is it goes around the client's finger while they're using the VR. And with this, we can track their skin conductance. So that's their arousal levels through how much sweat they're producing. Also, we can track their skin temperature and also their heart rate to measure things like stress and anxiety and at what points they're feeling most triggered. So if they go over to the slot machine and they're using that and it doesn't pay out, we can see how that affects them on like a biological level.
And fundamentally, so you're obviously helping patients with their triggers essentially. So how is this different, and how is it better from just talking about triggers in a therapy room?
So I think with a lot of people, they tend to struggle to identify certain triggers or certain emotions, especially when talking retrospectively, because if they were really heavily into their alcohol addiction, it could be quite difficult to keep track of certain emotions and reflections and things like that. So by using the VR, we actually bring those triggers, those emotions, those reflections into the here and now. And so we can act, do our therapeutic intervention whilst they're still here in treatment. And we can do it straight after the session and go, what happened at this moment? What was going on for you? What drew you to that drink? What was going on in your body?
And are there any particular sort of stages of recovery it's used for?
So we can use VR pretty much at any stage of recovery. Of course, we don't want to overwhelm our clients too soon by putting them in a scenario like the alcohol aisle in a supermarket, where they're really exposed to so many different kinds of alcoholic drinks like beers, wines, and spirits and things like that. So I can actually control the intensity of each scenario. So for example, I can control what drinks are actually in that supermarket aisle. So initially we would just start out with soft drinks, and that's to give the client some time to get used to the control, get used to the VR environment, and also kind of get a baseline level of reading on our biofeedback sensor. And then over time we can increase the intensity. We can add alcoholic drinks to that supermarket aisle. And for the house party scenario, it's exactly the same thing. I can control whether or not there's guests in that environment, whether there's drugs in that environment, whether there's alcohol environment. So we all work at the pace of the client, and their safety is our absolute priority.
And so let's talk about triggers more broadly then. So what are triggers in addiction, and what are some common examples in, say, something like alcoholism?
So it's such an interesting question. I really feel like it's one that I don't get asked enough. It's so simple for me to think about as an addiction therapist, that what triggers are, but to actually provide some context to it, it requires a lot of thought. And for me, I think the best way to say what a trigger is like when you go into a bakery for something like a coffee, and you're looking at the board and you're looking at the drinks, and you're seeing that, oh, should I get a frappuccino or should I get a milkshake? And you go, oh no, I'm trying to be good. I'm trying to cut down on my sugar. And then all of a sudden you smell something like donuts, and then you go, I've come to this bakery loads of times. I've never sold donuts before. And suddenly my mouth is dry and my heart is racing. And all of a sudden you get to the front and you see the donuts there, like it's glistening under the hot lamp in the display cabinet. And it turns out that the donuts are brand new and they're doing a promotional offer or something like that. And then all of a sudden you leave the bakery with 6 donuts that you shouldn't have bought. And the most annoying thing is when you're leaving that bakery, you're saying to yourself, I wasn't even hungry when I came in. I came in here for a coffee and I left here with donuts. So as soon as you smelt that scent of like freshly baked donuts, your brain is saying to you, I know what's going to happen next. So whenever I've smelt donuts before in my life, I've always eaten one. And that's exactly what a trigger is. It's just a mental and physical response to eating something or drinking something based on past habits and past experiences.
Yeah, it's funny that I live near a McDonald's, right next to one behind it. I'm sure that they're pumping out those smells. So when I'm walking past it, that's that same thing. They're obviously trying to react to that or trigger that trigger in my head almost of yeah. So it's interesting.
And you were saying, like in the context of alcohol addiction as well, certain triggers, we can apply the exact same idea to that we took from the bakery to something like a supermarket. So you could have like a very comprehensive shopping list, eggs, bread, milk, etc. And then all of a sudden you're leaving with a bottle of vodka that you shouldn't have had and you shouldn't have bought. And that could be due to a couple of things, something like going to like one of the nicer supermarkets with a bit of the posher, bottles of wine, the posher food. And there's you go to the fish aisle and there's salmon, and you're picking up salmon, and you go, this is where the nice wines are, aren't they? Oh, go to the alcohol aisle, and your brain goes, you're saying to yourself, oh no, I shouldn't be doing that. But you just say to yourself, oh, go look at the bottles, and you go all the way to the alcohol aisle, and then you're experiencing something called euphoric recall, and that is when the brain basically forgets all of past consequences that was related to alcohol use and only focuses on the romance and the fantasy of it. So you're picking up a bottle of wine that says Pinot Noir, best paired with salmon, and then you look at your basket and there's salmon in there. So that's when the trigger has fully come in, and all of a sudden you find yourself leaving with a bottle of wine when it was never on your shopping list.
Yeah, and I guess it sounds, so what you're describing is essentially like a brain process, and I guess is that why they're so difficult in terms of, like, it's such a big challenge for people in recovery, because it's essentially a brain process that you ultimately like feel like you can't control sometimes. Is that what you're working on, essentially, to try and almost like reframe that thought process, that trigger?
Yeah, absolutely. That's something that we're doing in VR as well. So by using something called cognitive behavioral therapy, CBT, there's a lot of work that's done on the addiction cycle. So if we think about triggers, CBT looks at how triggers influence thoughts, influence feelings, influences behavior, and influences consequences. So like you said, with that process, it's all about breaking that cycle. What can you do to break that cycle?
And then, so when someone is in a VR session and they're presented with a trigger, is the idea, have they been working on strategies to cope with that trigger and move past it? And what sort of strategies are they adopting and learning?
Sure. So one of the things that we do here at Eden House is CBT workshops. And a lot of it is focused on that addiction cycle as well, and talking about coping strategies. What can you do in that moment of high intensity and dangerous situations where alcohol is present and you're feeling triggered? So when we're using the VR, something we want to do is bring as much physical presence into the virtual world as possible. So breathing techniques, grounding techniques, and mindfulness techniques are very popular as well. So one of the things that I encourage the most is something called the 5-4-3-2-1 technique. And that is purely focused on making use of your senses. So if you're feeling triggered for any reason, we recommend using that technique. And that is 5 things that you can see, 4 things that you can touch, and 3 things that you can hear, 2 that you can smell, and 1 that you can taste. And using that in the virtual world is really practical, because there are so many things that you can interact with. And if a client is feeling triggered whilst using the VR environment and they do that, hopefully it will have taken them out of that like adrenaline moment, that euphoric recall moment, and provide, a bit more grounding and a bit more clarity on what's going on around them.
So you're using this VR therapy here at Eden House as part of the Priory's Flourish program. So just tell me a little bit more about that treatment.
So Flourish is a therapy-led, addiction-based service that also treats things like behavioral addictions as well. So gambling, pornography, social media. There are daily workshops, daily group therapy, and every client that comes in gets 2 one-to-ones a week. Also get 1 year of free aftercare, and eligible clients have access to our Recovery 360 program, and it is affordable, and we are also pet friendly, so you can bring your giraffe.
Amazing.